I'm Angela, and I'm a bilateral iFuse patient. I've struggled with back pain my whole life. It used to be that I would recover. It would take me a couple of weeks and I would move on with life and everything would go back to normal, and then I didn't start recovering. My husband and I own 3 businesses. We have a vineyard, a winery, and a tasting room, so that's one business. Then my husband's a surgical oncologist, and I manage his very busy full-time surgery practice and all the staff there. And then we also own 3 health and wellness clinics, and we divide and conquer, and he gets his list done and I get my list done, and all of a sudden my list was getting shorter and shorter of what I was able to do, and that's not me. We are all about helping our patients achieve the very best health that they possibly can. And I felt like I had become a fraud. I wasn't healthy. There was something terribly wrong with me that was affecting my everyday life. It was debilitating pain to stand after sitting. I would get out of the car from driving just 15 minutes down the road and literally had trouble walking into the grocery store. And I was in control of my world. I could accomplish anything that I wanted to accomplish in my businesses, but I wasn't in control of my body. And I knew I'd gotten to a point where I had to figure out what was going on with me. And that is when I contacted Dr. Keiper.
Hi, I'm Dr. Glenn Keiper. I founded the Spine Surgery Center of Eugene in 2004, and I subspecialize in the care of the spine. Today we're going to talk about the sacroiliac joint. The sacroiliac joint is part of the pelvis. It's the union between the ilium and the sacrum, and it transfers the load between your lower extremities and your spine, sort of like a shock absorber. Oftentimes the patients come into the office and they're complaining of back pain. It can radiate into their groin or down onto their thigh. Sometimes you have sciatic type pain, which is misleading. Further questioning reveals that they have difficulties with activities of daily living. They can't sleep on the affected side. They can't get in and out of bed easily. They can't go from a sitting to a standing position easily because of the pain. They oftentimes have trouble navigating stairs because it's just so painful, it becomes very difficult to perform simple activities. After I interview the patient in the office and I do the physical exam and the provocative maneuvers corroborate sacroiliitis, then the next step is to have them undergo a sacroiliac joint injection. They should get at least a short-term benefit from the injection, which is a mixture of local anesthetic and corticosteroid. I like to interview the patient again approximately 2 weeks after the injection to see how they're doing. Some people get long-term relief with that injection, and that means that that injection was therapeutic and has largely solved their problem. A lot of times people will describe the fact that the injection was 100% beneficial, but it only lasted about 3 days. For patients that don't respond to the conservative measures, it becomes appropriate to talk about more aggressive treatment, and that would be with surgery and using the iFuse devices to stabilize the sacroiliac joint. The surgery involves a small incision on the side of their buttock and the insertion of 3 dowels that are made out of 3D printed titanium. It inspires the bone in the sacrum and the ilium to grow together around the 3D printed titanium. The 3 dowels are very effective in stabilizing the joint, and many patients get immediate relief just from the stabilization itself. And others may have to wait for that fusion to become solid before they have a total relief of their pain syndrome.
As I was approaching time of surgery, I was nervous. I definitely was. I had asked around in the medical community and people were honest with me. They said, this is a big surgery. And I thought, it's my only hope. I had the surgery middle of the day. The next morning, I woke up and I thought, something feels different. I know I'm on pain meds, but I feel like something is better. And while I did have post-surgical pain, each day my life got better and better and better. And I don't mean better from surgery, I mean better from years ago. I was feeling less pain than I had felt in years. Since the surgery, it life just feels normal. It's just the simple things in life, bending over to pick up the dog toy, changing the washer to the dryer, unloading the dishwasher, sweeping the floor, picking up cases of wine. Gosh, there's so much that I wasn't able to do for so long, and I had become used to that life, and I didn't want that life, and now I got my life back.
The procedure has become one of my favorites to perform. It's fun to be able to offer something that makes such a strong impact in my patients' lives.